Where's the advance? Okay, well, obviously in 10 minutes, I'm not going to teach you how to get into hair, but I'm going to hopefully inspire you, challenge you, frighten you, I don't know, encourage you of all those things. It really begins, like everything in life, with vision. You have to know where you want to go before you can get there. And one of the exercises that I've loved is called the hot pen exercise, where basically you sit down and you write everything you want to be in the next 1 year, 5 years, 10 years without categorical assignments. You just, like, personally, professionally, intellectually, spiritually, wherever it is, and you just let your subconscious take its course. So a lot of times we get into hair because it's an added menu item. It's something else that we can do and make some more revenue. And I want to, hopefully by the end of this talk, change your brain. If you are going to go into it, you go in it for the right reasons. And so it really begins with passion. Well, how the heck do you have passion for something? Isn't it just hair? You know, I get this from my colleagues. And so for me, a cornerstone as an artist, I love painting every day. I love design and everything about it. It is creative. And so, well, how can it be creative? Aren't you just making little holes in the head? And no. When I design an eyebrow, it is a work of art for me. It's fun. I mean, dare I say fun. Hair is fun. It can be fun, and I hope I show you that in the next few minutes. It is fun. Female hairlines are very uniquely different. I try to follow the existing hair patterns and create whatever is left that's not there. Temporal points, male hairlines are challenging. They are not just holes. And when you begin to see how in natural hair, there's a natural flow of movement, and there are no abrupt angles, and you begin to mimic nature, then you get excited, and you can see the creativity that's involved there. And just like a Gunter diagram for rhinoplasty at the end, you want to draw, or what I do is I draw what I did, and it helps my placers know where to place things. And that's very important. So, you know, a journey of 1,000 miles, or whatever that saying, starts with the first step. I probably paraphrased it wrong, but basically, you got to make a move. And that move begins with self-education, self-exploration, going to meetings like this, thinking about things, being mentored. And it is not just about learning about hair transplantation. A lot of surgeons, as most of the people in this room are surgeons, they think about surgery, they want to know how to cut. And actually has a lot to do with taking a step back and realizing, for example, the top left just needs medical therapy. They don't need surgery. Medical therapy is the way to go. On the top right, this is frontal fibrosing alopecia. If you're a dermatologist in the room or you know what I'm talking about, this is something obvious. I've trained my staff to recognize this, so when they're doing a pre-consult, they say, here's a lady, she's really looks like FFA to me, I don't know. And I walk in the room and they're usually right. But obviously as a physician, I don't want to take that part out of it, because right now there are salesmen meeting with patients, there are technicians meeting with patients. They're no longer the physician who are making diagnoses, and that's a real crime. So FFA, if you operate on this, is a big problem. It's actually a trichologic emergency. In other words, if you operate on this and you don't, or you just leave them go home, this can advance to the point where it can't be reversed. It's a scarring type of alopecia, one of many. I see so many disasters happening every single week. It breaks my heart, and I'm not just saying these words. These are leading to people that are lifelong cripples. Why is that? Because you're transplanting too early. So who cares? Isn't FUE scarless? Absolutely not. There are dots in the back of the head, and then you got these weird little grafts that sit in the front of the head that can't be fixed, because the problem is you're not dealing with so right now you may have enough supply to fix a demand. But in hair restoration, you're dealing with ongoing dwindling supply, as well because of surgeries and advancing hair loss and increasing demand. And as a surgeon, my first goal when I walk into a consultation is, do I have enough grafts to fix, not today, but in 10 years, 20 years, 30 years, and 40 years? I don't have a predictive capacity, but having done this for 20 years, I begin to think about that. And DUPA, diffuse unpatterned alopecia, where you've got unusable donor hair. If a businessman or a salesman is going to meet with them and they're working to close a deal, they're going to sell everything. And DUPA is a no-fly zone. And the sad thing is I see this every week, and it's not DUPA, it's over-harvested FUE, destroyed donor hair. So you think, oh, you know what, I don't want that scar in the back of my head. How about a completely moth-eaten, destroyed backside, because the physician has never seen the patient, never doing the work? That's what I'm seeing every week, and these people are scarred for life. This is a destruction of humanity. And so it begins with education and practice. You can't master this in a day. You can't master rhinoplasty. You can't master deep plane facelift in a day. You must start with education and practice. So I'm a painter. I was asked last night, how did you start painting? YouTube. I started working, and I spent thousands of hours doing this. I spent a 6-hour tutorial learning how to paint waves. So this is where it starts. And so this is from one of my textbooks on hair transplant. I've written 8 of them. I make no money on them. They all go to charity. But this is just showing you from volume 1, just the stepwise of creating, how to create a hairline, the micro finesse points. And I'm not showing you how to do it because it's not the point of this lecture. It's just showing you that there is a creativity and there are skill sets that you can develop. Learning how to create density gradients so that you get the most favorable outcomes. When I'm doing a transplant, it's just like when I do a rhinoplasty. I'm very quiet during moments, like during counting. I'm constantly readjusting in my mind how many grafts I need for this area, how many grafts for this area. Am I doing enough here? Am I covering that? And in 20 years, I still struggle. I still think, I still rethink, and I'm still focused. So this is not just an exercise of mechanical execution. These are the books I've written. And my new FUE book that came out just in April, it's a 1,300 pages book. They all go to stop human trafficking. I make no money on anything that I'm talking about, so no disclosures here, but I am very passionate about them. And my course, also make no money on this course, coming up in the end of July. It is a huge didactic session, 2 long days, and a ton of a 1-to-8 ratio with faculty, where we're getting you a lot of hands-ons. And I always say, you can come and watch me, you're not gonna learn anything. When I watch you and I watch your hands move, I can correct it. I can oftentimes correct mistakes and come back around and look at you and realize, oh, you corrected your mistake. Now I want you to use your iPhone, film what you did. I want you to go back home and repeat this. And so when I watch you, I learn what errors you're making. When you watch me, you don't know anything. I'll promise you won't know anything. When I watch you, I know your mistakes. I can see it. I've done this for 20 years. I see where the issues are. So this is really, really important, is go to meetings, go to education, get hands-on experience for this. And I, as the past president last year of the American Board of Hair Restoration Surgery, I'm very, very passionate about ethical, quality hair restoration, and encourage you, if you guys are getting more mature in this industry, don't forget to become a diplomate of the American Board of Hair Restoration Surgery. And don't forget the strip. A lot of people think, well, you know what? It's all about FUE. And I will tell you, it's a spectrum right now. And I do 40% of my patients are females. And I don't see a great clinical indication for FUE. You can. I'm not saying if you're doing it, it's wrong. Absolutely not. But there are so many reasons, without going into details, because that's not the point of this talk. But with women, I defy you to find my scars. I mean, if you look up close, the hairstylists send me the patients because they can't find my scars. They're maybe, if in the worst case where I would consider a disaster is 3 millimeters. I'm hoping that it's 0 to 1 where you're struggling to find it. It'll take me about 5 minutes. I still can't quite make it out after about 6 months. So it's not about the scar. It's about donor management, and it's about quality results. And also extensive baldness. And we're doing FUE for the world. And as you've heard many times, and I've admitted in my last lecture, is that, you know, if all you've got is a hammer, the world is a nail. And that's a real problem. You need to have more things in your tool belt. So invest in your practice. New technologies are there. For me, the big impetus to rewrite my FUE book was the advent of hybrid technology, which basically means these technologies with a blunt front end and a sharp outer edge. It looks like a trumpet. It creates this cleanest, most beautiful grafts, lowest transection rate, much easier to harvest with. And so these are where things are. And I have 2 of each of these machines. So you have to invest in your technology, and you've got to have the right people there. Look for where you suck at in life. Your staff know why you suck. Your team knows what you suck. You better know what you suck at, and you better hire people that can help fulfill and work with you so you have a great team. And so teamwork is really, really important. It's all coming from top. Focus, which really means hair is not a step bastard child of your practice. If it is, it will never grow. It never grew in my first few years because that's the way I thought about it, until I realized, you know what? I want to really be great at this. I want to be dedicated to this. And so you have a dedicated website, a dedicated videos, dedicated discussion, and dedicate yourself to learn it. When I talk to dermatologists, I tell them, look, if you want to be better hair surgeons, learn surgery better. When I talk to surgeons, I tell them, first cut down your arrogance, because you need to learn to be better hair surgeons, not just facial plastic surgeons or facial surgeons, but also learn hair diseases and be better dermatologists. Have energy, and the time, everything in life takes energy. Whatever you leave it on the table if you don't want to do it. Don't just do it because it's out there. Make a concerted effort to make that decision. So I'm going to end with this quote in the last 20 seconds here from Steve Jobs. You've got to find what you love. Your work is going to fill a large part of your life, and the only way to be truly satisfied is to do what you believe is great work. And the only way to do great work is to love what you do. If you haven't found it yet, keep looking, don't settle. And that's my last last comment for you who are thinking about hair. I hope I've inspired you to go into it. And I also hope if you were wishy-washy and thinking, well, maybe I don't want to do it, and don't do it for the wrong reasons is really the key things. Because you know what? You owe it to these young men that I see every day being crippled by this industry of a corporate practice of medicine, of people just doing surgeries that should not be doing surgery on patients that should never be getting surgery. Thank you.